The normal spleen is usually slightly more echogenic than normal liver or normal renal cortex. When the spleen appears isoechoic compared to liver, you must consider which tissue is abnormal. In this case of chronic Cushing's disease, the liver has increased echogenicity and the spleen is normal. Spleen is identified by the presence of veins crossing the capsule. The spleen appears hypoechoic compared to renal cortex in this cat with fat deposits in the kidney. A general increase in echogenicity of the spleen can suggest chronic disease. Note the hyperechoic fat around the spleen and intestines. An enlarged, mottled, or hypoechoic spleen could result from sedation with drugs, such as acepromazine. It may also occur with passive congestion of the spleen due to portal hypertension associated with right heart failure or hepatic fibrosis. As we learned in the liver DVD, an enlarged extrahepatic portal vein can suggest right-sided congestive heart failure or liver cirrhosis and cause secondary enlargement of the spleen due to congestion. In most cases, splenic lesions take the shape of a nodule, which may be hypoechoic, hyperechoic, or mixed echoic in appearance. Small nodules that are not in contact with the splenic capsule can be rechecked with serial ultrasound exams over a period of weeks or months. Biopsy should be considered if the lesion is increasing in size. The effusion in this case was not from the spleen. Even small nodules in contact with the splenic capsule could weaken the capsule enough to result in rupture and hemorrhage. If ultrasound reveals nodules that deform the capsule and shape of the spleen, splenectomy followed by histopathology should be recommended. Nodules of lymphoid hyperplasia can grow quite large and rupture, resulting in the death of the patient. Removal of the spleen can save the patient's life. Lymphoid hyperplasia is not neoplasia and will not metastasize. A definitive diagnosis cannot be made with ultrasound. Do not assume that every splenic mass is neoplasia. Histopathology of the lesion is required. The mass in the spleen of the dog in this video was shown to be lymphoma. All patient data should be considered when there is a loss of homogeneous parenchymal appearance of the spleen. Does the patient have any known disease processes, symptoms, laboratory results, or other ultrasound findings that may be related to the splenic lesions? The lymphoid hyperplasia in this dog was rechecked by ultrasound every 3 to 6 months for 3 years, with little change in size, shape, or appearance. This patient has chronic inflammatory bowel disease, which may be related to the splenic lymphoid hyperplasia. One day the patient was running and suddenly cried out in pain, followed by abdominal splinting. These are common signs of a dog showing acute stretching or rupture of the splenic capsule due to hemorrhage into or outside of the spleen. Splenectomy was performed and the patient recovered. These are images of the splenic mass during surgery. Hemorrhage was within the parenchyma of the spleen. This is my dog. He was free. The presence of multiple small hyperechoic nodules or lesions, as seen in this 13-year-old cat with inflammatory bowel disease, is thought to suggest multiple microinfarcts or old microabscesses. These lesions indicate a previous or ongoing inflammatory response and damage within the spleen.